A to Z Nursing Blogs presents you here another video on the nursing management for infection control. Let's dive into the video. Number 1. Nursing Assessment. The nurse obtains the client's history, conducts physical assessment and gathers laboratory data. History. During the history collection, the nurse assesses number 1. The degree to which the client is at risk of developing an infection, and number 2. Any client complaint suggesting the presence of an infection. Physical examination. Signs and symptoms of an infection vary according to the body area involved. For example, sneezing, watery or mucoid discharge from the nose, nasal stuffiness, which commonly occur with an infection of the nose and sinuses, urinary frequency, and cloudy or discolored urine often occur with an urinary infection. Laboratory data. Laboratory data that indicates the presence of an infection include the following: elevated leukocyte count, increases in specific type of leukocytes as revealed in the differential WBC count, elevated erythrocyte sedimentation rate, urine, blood, sputum, or other drainage cultures that indicate the presence of pathogenic microorganisms. Nursing diagnosis. Based on the assessment data, the most appropriate nursing diagnoses are potential complication of infection, fever, balanced nutrition less than the body requirements, acute pain, impaired social interaction or social isolation, anxiety. Nursing care planning and goals. The major goals are maintain or restore defenses, avoid the spread of infectious organisms, reduce or alleviate problems associated with the infection. Implementation. The nurse prevents strategies to prevent the infection. Preventing nosocomial infection. Meticulous use of medical and surgical asepsis is necessary to prevent the transport of potentially infectious microorganisms. The next important one is hand hygiene. It is important for both the nurses and the client's hands to be cleansed at the following times to prevent the spread of microorganisms: before eating, after using the bedpan or toilet, and after the hands have come in contact with any body substances. Nutrition. A balanced diet enhances the health of all body tissues, helps to keep the skin intact, and promotes the skin's ability to repel microorganisms. Adequate nutrition enables the tissues to maintain and rebuild themselves and helps keep the immune system functioning well. Fluids. Fluid intake permits fluid output that flushes out the bladder and urethra, removing microorganisms that can cause an infection. Sleep. Adequate sleep is essential to health and to renewing energy. Stress. Excessive stress predisposes people to infections. Nurses can assist clients to learn stress reducing techniques. Immunizations. The use of immunizations has dramatically decreased the incidences of infectious diseases. It is recommended that immunizations begin shortly after birth and be completed in early childhood except for boosters. Disinfecting. The first links in the chain of infection, the etiologic agent and the reservoir, are interrupted with the use of antiseptics. Antiseptics are the agents that inhibit the growth of some microorganisms, and disinfectants, which are the agents that destroy pathogens other than the spores, and by sterilization. Both antiseptics and disinfectants are said to have bactericidal or bacteriostatic properties. A bactericidal preparation destroys bacteria, whereas a bacteriostatic preparation prevents the growth and reproduction of some bacteria. Sterilization. Sterilization is a process that destroys all microorganisms, including spores and viruses. Four commonly used methods of sterilizations are moist heat. To sterilize with moist heat, steam under pressure is used because it attains temperatures higher than the boiling point. Gas, which is ethylene oxide gas, which destroys the microorganisms by interfering with their metabolic processes. Boiling water. This is the most practical and inexpensive method for sterilizing in the home. And radiation. Both ionizing and non-ionizing are used for disinfection and sterilization. Thanks for watching. If the contents of this video are informative, like and share the video. Subscribe the channel for more videos and updates. Thank you.